Good evening, folks, and welcome to AIDS Forum Live. My name is Mark Hutchinson. I am a person with AIDS and your host for this evening's program. This is the third live program of our 1991-92 season. Tonight we'll be discussing approaches to promote and maintain a healthy immune system. The purpose of this evening's program is to introduce you, our audience, to some of the options available to people living with HIV and some of the methods available within the Portland community for promoting our healthy immune systems. I would like to remind you that the traditional Western medical practices and treatments for HIV and AIDS are discussed on the first and second Mondays of the month. We'll be hearing about and discussing other approaches this evening. Our guests tonight are, first of all, Rick Tusher, an osteopathic physician who is in private practice, and part of his practice includes working one-on-one and in small groups with people with HIV. Patricia Francesca Newton, MD, whose work focuses on guided imagery and psychotherapy. Francesca is in private practice and also works part-time at the center in Northwest Portland. And David Eisen, who's a licensed acupuncturist and doctor of Oriental Medicine and the director of the Portland Addictions and Acupuncture Clinic. I've asked each of our guests to tell you a bit about the nature of their work as a form of introduction, and later on in the program we'll invite you to call in with questions for our guests. I'd like to start with Francesca Newton, please.
Thank you. I've been in practice for the last 4 years at the center. I am an internist, and I am very interested in the use of imagery as it relates to health. My training, as I said, is in internal medicine, and I have practiced and used imagery for the last 10 years, partly at the time when I was working at the VA and now at the center. And I have worked with a number of things with imagery. I've worked with pain, I've worked with all kinds of different symptoms, physical symptoms, and many illnesses. Over the last 4 years, I've been involved in working with HIV disease. And let me tell you a little bit about what I mean by imagery and the use of the imagination. We all have the ability to create images, and we all have very vivid and creative imaginations. Like if I was to ask you to imagine a wonderful scene at the beach, people could either get a visual image or a feeling sense of what that would be like. And probably most importantly, that if you keep concentrating on that image, like you're concentrating on nice feeling at the coast or the nice water, that you start to get a feeling sense inside that is different from the feeling sense that you would have if you were imagining being in heavy, stressful traffic, for example. So that actually the body internally responds to the image that's in the mind. And we know this actually from a lot of studies that have been done using hypnosis. Some studies, for example, if you imagine running, and you relax and you very vividly imagine running, that the hormones in your body that are activated when you run actually will increase in your blood. You will have a physiological response to the image. And all the little muscles, if you measure them on an EMG, will actually start to contract and release the way that they do if you would be running. So your body responds to the image. As an example, if you sit down and imagine eating a nice big dinner, your stomach will also release the gastric acid and all the hormones that it usually does right after you have eaten, so that we know that the body responds to these images. Now the question is the body going to respond to images about the immune system? Well, we don't know this for sure yet, but what we do know is that the brain and one's psychological state and images do have a lot of influence over the immune system. That there's a whole area of study now called psychoneuroimmunology, which basically means that the emotions and the brain interact with the immune system. And actually it works both ways. The immune system actually has an effect on the brain as well. And what we know is that there is a deep part of the brain called the hypothalamus and the limbic system. It's kind of like right back here. That secretes different kinds of substances, hormones and neuropeptides, which are very influential in keeping the immune system strong and healthy. It can make T cells function better. It can make other cells of the immune system, like killer cells and macrophages, which are involved in directly devouring invaders and protecting your body, be stronger. So the substances that come from this deep part of the mind really do have profound effects on the immune system. And conversely, there are things that can be secreted, such as the stress hormones and other hormones that are secreted when we're depressed that can have a negative effect on the immune system. The part of the brain that actually influences the immune system is actually connected right down in what's called the limbic brain, which is the part of the brain that dreams and the part of the brain that has images. And there have been a number of studies using small number of people who have been experienced meditators or experienced people who have worked a lot with imagery, and been able to show that they can have an influence on the functioning of their immune system cells. They can have their T cells work better. They can have their macrophages, or big eaters, the cells that devour invaders, be able to be better devourers. They can have their killer cells be more effective. So that there is research showing that people who are good meditators can influence their immune system. With this in mind, knowing that there is a relationship between the brain and the immune system, we've developed, my partner Lucia Marks and I have developed a way of working with imagery based on a lot of the work of Jean Achterberg, in which we help people develop their own specific images using their own imagination of their immune system being strong and effectively destroying the virus. We frequently start with imagining this part of the deep brain releasing substances into the blood and going into the circulation and creating systems of very strong T cells that are able to fight off the virus. We work with this also in terms of helping people create images of a warrior, or of a strong immune system, or a warrior that can stand for them and stand for them and against the virus. And we've done this for a number of reasons, but kind of looking at the long-term survival data of interviewing people who are long-term AIDS survivors. There have been a couple of studies now showing that these are people that are not necessarily angry, but are assertive. And one study showed that the most important thing was their ability to say no. And their ability, if they needed to take some time to rest, would be to say to a friend, no, I can't do that today. So that the data suggests that people who are more emotionally expressive, able to stand up for themselves and able to kind of have a warrior in their life, tend to do a little bit better. This is not to say that if those are not your personality characteristics that you won't do well, and it's also not to say that if you're not doing well, it's because you're doing something wrong psychologically. It's just something that we have begun to notice, so that we think in our work that we're teaching the people through imagery, through having them have clear and distinct images of their immune system. We're helping people create the environment inside their body that is most associated with promoting the immune system, and at least there's some evidence is associated with survival. Has this been proven? No, it hasn't really been proven. This is really a theory. but a theory, I think, all the time that's shifting and that is getting more scientific data to back it up. Having done these shows for some time, 5 years ago when I talked on this topic, I did not have the scientific backup that I do now. And so with that as a background, just to give you a scheme of what I do, I think I'll stop for now.
Thank you. David, would you like to go next?
Well, I've been working with people with HIV disease now, Mark, for about 7 years. Originally started the work back in Boston, Massachusetts, with the AIDS Action Committee and a subgroup called the Holistic Therapies Team. And at that point in time, we were seeing that traditional Chinese medicine was having an impact on folks that had what we call stage 4 or full-blown AIDS and who were very, very sick and very, very deficient within the dying process, be able to give them a lot more comfort. And we were very impressed with, at least with the clinical results that we were getting with easing pain, reducing stress and anxiety, and allowing people to have more comfort. And there is a fairly small but loud body of knowledge that looks at stress and anxiety and how it affects the immune system. So at that small juncture, we started seeing that, yes, acupuncture and traditional Chinese medicine could have a indirect, at least, and maybe direct at best effect on either maintaining or helping maintain the immune system function, albeit non-specific, but function nonetheless. And instead, what I'd like to do, instead of going through a myriad of symptomology and lab results, what I'd like to do is give an overall theory of traditional Chinese medicine and how it relates to the body and the immune system, and then from there possibly look at some symptomology and what people can expect and not expect from traditional Chinese medicine and how it relates to long-term survival, what people can expect and not expect in terms of building the immune system. Well, traditional Chinese medicine is probably like the grandparent of holistic therapy. It's been on the planet for about 3,000, 3,500 years, and it employs a myriad of approaches to establishing and maintaining health. It looks at diet and exercise and movement and herbal medication therapy and acupuncture and massage and everything that one could look at from an external as well as internal source from helping maintain health. And it's from that perspective that Chinese medicine operates. It's of maintaining a balance, and that's what it's always going toward, as opposed to allopathic medicine, which chooses to either mask symptomology or override symptom with an artificial substance. Chinese medicine looks toward establishing or maintaining balance. And in a nutshell, that's the underlying premise behind it. We don't have time to go into a huge theoretical, and that's all it can be at this point because mechanism of action, at least from acupuncture, is still unknown. But from a theoretical point, we don't have enough time to go into it. Suffice it to say that we're trying to establish balance, and by doing that, the body's ability to efficiently operate is maintained. In traditional Chinese medicine, we look at the balance of the body through establishing a harmonious flow of something called qi, energy. You either feel it or you see it or you can touch it. It's a physiological phenomenon. It's not a physical reality. I couldn't cut my arm and like I could see veins and tendons and sinew. I couldn't do that with qi, but it's something that you can feel. And there are some technologies out there like Kirlian photography that measure electromagnetic and electrical resistance in the body, shows us that this in fact does exist. And to make a long story short, what we try to do, at least with acupuncture, is get this energy flowing in a free and unobstructed manner, which will then affect organ functioning, which will then affect how the body operates and is able to either fend off something invading from the outside or deal with something that's already invaded and is starting to attack internal organs or other aspects of the body. Acupuncture aside, there's then herbal medicine, which basically attempts, at least from a Chinese medical perspective, to do the same thing. It attempts to not override a system, It attempts not to mask a symptomological process from occurring or manifesting, but what it attempts to do is get the body to a place where it's operating more efficiently to ameliorate the symptoms through an efficient process, not by masking or overriding. And then concurrently looking at nutritional supplements or just what people eat. You'd be amazed at what people who think they are eating a healthy diet really are eating. I mean, it's an amazing thing for us, especially with folks with HIV disease that still eat Twinkies and pop for lunch, that don't think that exercise is important, that still smoking 2-3 packs of cigarettes a day, that are still either drinking too much or to excess, things of that nature. Now at PAC, at Portland Addictions Acupuncture Center, we see a lot of chemically dependent folks with AIDS. So we have this double-edged situation that we have to deal with. Not only do we have to deal with the diagnosis of HIV or full-blown AIDS, but we also have to deal with the diagnosis of chemical dependency. So we've got this onion that we've got to peel and go through layer upon layer of helping people empower themselves to take control over a situation, which I think clinically is going to help build their immune system. When people can start feeling more positive about what they're doing, with whether or not they're coming to us for treatment, whether or not they're going to Lucia and Francesca to learn how to do it for themselves. And by the way, I'd just like to say to the audience and to the rest of the people here, I don't think there's one answer to building the immune system. I think what Rick will talk about, what Francesca spoke on, and what we do at PAC are all pieces of a puzzle that can be used to help build and maintain a stronger immune system. None of us here would profess to have an answer or a cure for HIV disease, but there are treatments available out there, and that's what we're trying to do. And I think I'm real happy that we can come together to discuss this, not only to the community, but amongst ourselves as healthcare providers, because I think it's real important to learn from each other what we can do and not do. As I alluded to when I began talking, one of the other things that we found very effective, at least with acupuncture alone, was the ability to help people reduce their stress and anxiety levels. And if nothing else, if we had nothing else to offer somebody, that would be enough, I think. Stress and anxiety, as anybody will tell you, will affect how they eat or not eat, how they sleep or don't sleep, how active they can be sexually or not, how well they fight off a cold, how often they get colds. And the literature is quite clear and specific and qualitative around acupuncture's effect to reduce stress and anxiety. Empirically, we see that Chinese medicine helps normalize T-cell ratio in some people, helps to improve aggregate T-cell in some folks, helps build hematocrit, helps platelet count, and helps in general people feel a greater sense of well-being. And this is how we are attempting at PAC to help people with HIV disease build and maintain better immune systems. And hopefully when calls come in later, we can go into more specifics.
All right. Thank you, David. And then we have Rick Tusher.
Thank you, David. As a way of introducing you to the work I do, I thought I'd share with you a few of the concepts that upon which the work is based. And one of those is that we believe that by doing everything we can to create a future worth living into, regardless of the circumstances, that's the approach we would take. There's increasing evidence, as Francesca said, that our immune system is capable of handling all of the attacks and assaults that are put upon it if we do two things. One is avoid the barriers and the function, and avoid the barriers to its function, and seek out those things which can enhance its function. It would be helpful also that if we have a condition, that we be responsible to that condition, but not for it. So many times in arenas such as we're talking about, well-meaning people will say something that many will assume means that there's something wrong with them, or they're feeling guilty about what they've done to themselves. This is not useful thinking. So we work with that if people are thinking like that. One of the helpful things is to be listening well enough so that you spot when people are thinking like that. You have to listen very carefully because it's hidden in the speech. The manner or the content of our speaking and thinking is the primary determinant, I feel, of what we will create for our future. It's sort of the Pygmalion effect. You may have heard of that. Or some people have called it a self-fulfilling prophecy. Very important, and if we listen very carefully to not only our conversations within ourselves, but to others, we'll identify those characteristics of our speech, that content that's very subtle, but we're literally creating a future that we may not want to live into. Ultimately, nearly all of the chronic diseases arise by or are severely affected by a poorly functioning immune system. With AIDS, we're dealing with a severe compromise to the immune system. And now I'd like to cover many factors in the three areas that I mentioned earlier, all of which will enhance the functioning of the immune system. And there's evidence for this in many cases, and we've observed it, and I think everybody here has observed some of the things that we can't prove scientifically right now, but there's increasing evidence toward that. First of all, I'd like to cover some of the things that would be useful to avoid for people who want to enhance their immune system, be they HIV positive or have any other chronic disease, or merely want to enhance what we call high-level well-being. One thing would be to avoid toxicants. David talked about this. By avoiding caffeine, nicotine, impurities in our water, environmental pollutants, some of the food and food combinations that we take in are not really serving a well-functioning immune system or high-level well-being. Anger and fear, those I consider toxicants right along with environmental pollutants. They're polluting our mind and don't really enhance high-level functioning. In fact, there have been studies that have shown that anger and fear can severely affect and decrease the effective functioning of the immune system. Sometimes we're in jobs that don't serve us. If we're in occupations where we go in and we're dealing with constant stress, some stress in our lives is essential to function as human beings. That's what keeps us moving. But that stress can often get to a point where it's doing us in rather than enhancing us. Relationships that don't work. I tell people if they're in a relationship that's not working, handle it. It's not serving our well-being or the functioning of our immune system. Then, too, we can have unhealthy belief systems, what we believe to be true about the condition that we have, the way we're living our lives, the way we're dealing with ourselves, why we're here, and so forth. As I mentioned before, our language and our speaking. We may include, very much including the conversations that we have with ourselves. And some people, when they're first doing this kind of work, think, self-talk. I don't talk to myself. And what they soon realize is, as we speak, they're analyzing, having some judgment or having a conversation about what's happening at the moment. So actually, all of these first few avoidance things, or these factors that I've mentioned, are really toxicants in a way. There are two other things here. There are things that we can seek from outside of ourselves that may be useful. One primary thing, and the reason we're all here tonight, is to seek our health care and our health care provider that's appropriate for us. A provider, I believe, who's willing to and able to be a coach to you in the sense that they will work with you and have a dialogue with you in exploring what's best for you. David mentioned the path for all of us, I believe, is very, very different. What's good for one individual that will enhance their immune system may not be appropriate for another individual. I also feel strongly, as David and Francesca have both said, that some form of what has been called, for lack of a better term, energy or vibrational medicine is very, very helpful. Acupuncture, acupressure, osteopathy in the cranial field. David, I'm an osteopathic physician, and I work with the same type of energy that David is working with in the acupuncture field. Chiropractic, any form of mind-body work in the hands of a caring, compassionate practitioner, such as Hakomi or massage. Then there are the medications and substances that are available to all of us. This is a very confusing area, and if you read a number of different sources, you'll get very conflicting data in some cases. And I think all of us have to search out, study, and identify what works for us, from allopathic medications and drugs, to herbal preparations, to Chinese medicine, to homeopathic preparation. It's all there and available to us. A high-level wellness diet. I believe that's going to be gone into in greater detail on another segment of this program.
Yes.
And I won't go into the detail here, but I, like David, am appalled by what some people eat and consider it high-level well-being. Some form of exercise is appropriate. That may be something aerobic. It means whatever you can do to enhance your well-being, preferably with a good coach who can help you determine what form of exercise you're able to do and can do safely and effectively for yourself. And I also feel very strongly that some form of altruistic activity, giving of oneself, is important to maintaining high-level well-being and to enhancing the function of the immune system. In fact, there are studies that have shown from the East primarily that giving of oneself does indeed enhance the functioning of the immune system. And the final area is involving those things that we can seek from within ourselves. And an old philosopher many hundreds of years ago spoke about knowing thyself, and I think this is very critical. It has to do with the area of personal growth through many means. You can read, you can study, you can become an expert meditator, and Francesca, there are many studies, as you pointed out, that have shown that meditators live longer. A study by Blue Cross in the Midwest in '86 showed a significant reduction in healthcare visits for people who were chronic meditators, let's say. Meditation may be one addiction that would be useful to us all. There's guided imagery also, which is more of what Francesca was speaking of. Workshops and support groups. Dream work, for instance, will help us engage with that part of ourself that can help us to get to know ourselves better and truly become all that we are capable of being. So all of this and more can help us become increasingly conscious of our belief system, managing our internal conversations and self-talk in a manner better serving our well-being, and knowing the intentions, learning the intentions behind our actions and the results that they are going to have. We can depend absolutely that whatever we do, whatever intention we have, will have a result. So we must learn that intention behind an action so that we know what really determines the result. My opinion towards that is knowing that we're going to have a result of what we think or do or say or intend, we may as well plan it to be a result that we want rather than one we don't want. I've covered a mass of information in a short time here now as an overview. Is it confusing? You bet it is. To know what's right for you would involve talking to people, talking to friends, talking to healthcare providers, engaging in a dialogue with them, like the members of this panel. Read. I recommend that you read all you can about a subject to gain more information about it. And then finally, trust your own intuition. As you get more and more in touch with who you are and what works for you, it's easier. It becomes easier to trust what you really feel is right for you. Is it easy? No way. It's very hard to work and do the inner work that is necessary to seek high-level well-being. The reward is worth it, and it does get easier as you go forth. Is it scary? Yes, it is. It's scary for a lot of folks to really get to know who they are. I often tell people in my workshops that one of the longest journeys they'll ever take is that 17 inches from here to here, and get to know who they really are. So in a way, also, our focus today on the immune system as a phenomena to be studied is, as an objective phenomena, is very narrow in itself. And you've heard all of us, as I listened to all of us speaking tonight, I noticed a common thread, and that is that perhaps what would also promote a healthy immune system would be to seek harmony within the body and between ourselves and our universe.
Thank you. At this time, I'd like to invite members of our audience to call in with questions. The phone number is 288-4222, and please call in and see if we have any questions here for our guests. We have a caller. You're on the air.
Hi. My question is, depending on where you start doing these behavioral changes, 25, 50, 40, how much can you affect what you've already done, or the derogatory, negative occurrences that have already taken place, I guess?
Thank you for your question. Francesca, do you want to respond to that?
Well, maybe all of us can.
Yeah.
I mean, it's an important question, and I know I've talked to a lot of people who thought, gee whiz, I've done a lot of bad things to my body. Does it make a difference now that I stop smoking, or that I do a behavior change, or gee whiz, maybe I'm sick, maybe it doesn't matter. And I don't think that I can quantitate, maybe somebody else can here. But I know that in certain things, like in stopping smoking per se, I know that's not necessarily about the immune system, that after a number of years, 5 to 10 years, your risk for cancer is equal to the general population. And same is for controlling other illnesses, so that it does make a difference. The body has a resilience that seems to come through. And I kind of think of it that maybe in the idea that this is the first day of the rest of your life. And so that there are rewards along the path every day. And we may not ever, any one of us, get to the perfect end. Probably most of us won't. But that there are rewards on being on the path. And I think that the process of it all, and that's one thing in imagery in this work, since I don't really consider it that it's going to miraculously heal things, but that the process of being in it is helpful and enlivening and beautiful in its own way.
I would have to really echo what Francesca said. It's basically a quality of life issue. I mean, everything, it's my own personal opinion, that everything you can do to increase your quality of life, whether it's a chronic disease, whether it's HIV disease, whether it's another potentially life-threatening situation, if we can do anything to help us feel better, to think better, to live a better quality of life, then do it. We see people that in the clinic that have been shooting IV drugs for 15, 20 years and thought that they would never have a life above and beyond it. And they get clean and sober, and they enjoy that. And whether they've got, and quite a few of them have HIV disease, and it enables them to go to another plane with how they have relationships with the people in their lives or not, how they assume responsibility and feel good about assuming responsibility, etc. So I would say it's never too late to start.
That's exactly what I was going to concur with, David, that it is never too late to start, I believe. Whether you're 8 or 80, it's never too late to start the path of your own well-being, and the path you can discover for yourself.
Well, we're waiting for other callers here. The number again is 288-4222. David, I'm familiar with the acupuncture clinic, but what do you say to someone who's afraid of needles?
Oh, what do I say to somebody who's afraid of needles? Sit down and try it and tell me if it hurts. I mean, that's the first thing I do. And as we're talking, I'll insert a needle and show them that it doesn't hurt, and we'll get beyond that real quickly. I say there's about 1 in 4,000 people that we see that are truly needle phobic, and I'll send them to Francesca for some imagery work. But the clinic itself is unique. It is, we do treatment in a group setting. It's a social setting. It's a public health setting. It's not little cubicles where you're seeing a provider. We believe that if we can share the experience of not only being sick but getting well together and get that support, it will go a long way for somebody being supported in that process.
Thank you. We have another caller. You're on the air. Go ahead.
Hello?
Hello.
Yes. I had acupuncture with the needles and stuff, and it didn't bother me because once you put the first one in, you just feel a little twinge. That's all you feel. And plus, on the other hand, you see, I don't have AIDS, but we need to inform people who don't have AIDS on how to help people that do. And that's a real problem because we don't know how to help them. And so a lot of times, I'm a handicapped person, and a lot of times people don't know how to handle my situation, so they run from it or they don't know how to adapt to it, and then they condemn me for how I do stuff. Well, then it's the same thing on AIDS and stuff, and if we don't cure some of these diseases in our lifetime, we're never going to solve any of them, none of them.
Well, thank you very much for your comments.
Thank you.
I was wondering, Francesca, maybe if maybe you could tell me a little bit about what, for a first visit, some of the things you might discuss or.
Well, actually, I'd actually like to comment on what the gentleman who just called in said. That it's actually something that I work a lot with people. I think it's a very empowering thing to learn that you can teach people how to take care of you. That people really don't know how to approach somebody with a chronic illness. They don't know what to say. They get real awkward. They say dumb things. And a lot of it's because they really don't know. And then the person who has that illness either frequently feels hurt or feels like that they can't talk to that person. And there's a lot to be said about training people on how to support you. In saying, I really need to talk now, and all I really want you to do is listen. I don't need any advice or I don't need any ideas. I just like for you to listen. And that is a perfectly appropriate and good thing to do. I remember I had surgery once a couple of years ago, and it was a great learning for me because I gave a lot of my friends and family a job. Would you cook me dinner, preferably chicken on this day? And they loved it, and it worked great because then they could help. They didn't have to worry about whether or not they were doing the right thing, and I got exactly what I needed. And so I really agree with what he said, and there's a lot of empowerment actually that comes. And I think that one of the ways that with HIV disease, this can be such a disempowering illness in so many ways that frequently I think what we're all doing is teaching empowerment, personal empowerment. And part of that is being able to know inside, first of all, what you do need. And I think that being in a relaxed state, in an imagery state, you can have a sense of that, plus knowing that you have the right to ask for it. Do other people have comments on that?
Yes, I do. I think that one of the biggest lessons that the healthcare industry in the United States is going to learn from the HIV epidemic is how to be with people who have serious life-threatening illnesses. I think we'll learn it on a level that we've never learned it before. In my own practice, I've had very few people die. However, those who have, one in particular that I'm thinking of, was an enormous gift to me in the way he was able to teach me to be with him and not feel I had to do anything, but just be totally present with him as he passed on.
I think the nature of HIV disease is such that it comes at us from so many different sides, secondary infections and primary infections and opportunistic infections that take in that there's speaking as a person with AIDS, there's a tremendous sense of loss that goes on and a real uncertainty in some instances. And I find the work that all of you do really beneficial to my healthcare program. We have another caller. No, we don't.
Yep.
Okay.
Yep.
So anyway, just kind of to finish that thought, it's I've worked and seen acupuncturists as a result of stress management. I've also used acupuncture to treat side effects for some of the allopathic medicines that I've been on, and worked with Francesca's partner Lucia in Marks in guided imagery in helping to stimulate the appetite when I was going through the chemotherapy process. Finding the warrior, that wasn't actually an image that we were looking for in me, but in discovering my own imagery in meditation and listen to the meditative tapes on a daily basis that have been real helpful. We do have another caller now. Go ahead, caller.
Yes. My name's Raul.
Hello.
And I really agree with everything that you all are saying. I have this disease, and but I wish we'd find some better words than these words like empowerment and disempowerment. And it sure does sound like a new religion or something. Thank you.
Thank you.
I'd like to comment to that. As Rick was talking about before, language is a very powerful thing.
Yes.
And to speak to what the caller had just said, I can appreciate the need for the language of dealing with HIV disease to be a very a fine line and a fine road to hoe, because there are so many taboos and there are so many uncomfortable things that can be said or not said. And but I think though that it's real important that, especially with this disease and with other chronic diseases, is that what I've seen clinically at least is that when folks can get a sense of being able to do more for themselves, maybe that's the kind of language we need to do, that they will do more for themselves, and when they can do more for themselves, they'll feel better, and that's the bottom line.
We have another phone call. Go ahead, you're on the air.
Can you hear me? Hello?
Hello.
Hi. My question is, can you specifically address research data and research that is taking place toward the HIV virus people and chronic disorders, and how these behaviors affect, I guess, those disorders that have already been diagnosed?
Oh, okay. Research in terms of acupuncture or guided imagery or the work that Rick is doing? I'm going to assume so. So thank you. And
think most of the research that's being done nowadays, sadly, is in the pharmaceutical arena. David and I would both love to have grants that would enable us to do studies.
Francesca would also.
Yes,
Let's
we
give
all
her
would.
some money while we're at it.
And David too, while we're at it. Would like to have the ability to study this in greater detail. There are many studies that have shown, as I alluded to earlier, the Blue Cross study in '86, I believe it was, that have shown the effect of the kind of work that all three of us do. There is a lot of anecdotal evidence, and there's increasing studies, but I can't cite them specifically right now because I don't have that information at my fingertips. But there are hundreds, literally hundreds of studies over the past 50 years, by the way, that have shown the beneficial value of this work.
In the field of traditional Chinese medicine, there are 2 ongoing studies right now. Burroughs Wellcomes is not blasting down my door to give me $30 million to study the mechanism of action and how herbs and acupuncture improve T-cell ratio or aggregate counts. But in Boston, there's one study studying acupuncture for treatment of neuropathy related to HIV disease, and University of Miami Medical School, a friend of mine, Dr. Janet Kneffel, who's an acupuncturist, is studying an herbal, non-specific immune-enhancing herbal supplement for HIV disease. But there's no data yet. We just have, as Rick said, a lot of empirical, anecdotal stuff so far.
I would like to speak to that question. There are innumerable studies in the literature that look at quality of life, enhancement of mood, decreased pain using group support and group support using imagery, both with HIV disease and with cancer and other chronic illnesses. Now, specifically with HIV disease, there are some studies that are being done. One is actually at the University of Miami in Florida, where they're studying an intervention of group support using imagery and relaxation with people around the time of notification of HIV status. And what they're basically showing is that people who have been trained in groups to use imagery, relaxation, and exercise, plus group support, that their immune system is protected from the changes that occur negatively around the time of seronotification. So they are immune somewhat to the stress, and their immune systems do not take that dip. There are other studies looking at psychosocial intervention and immune functions in cancer patients down at UCLA. Probably the best known one is not with HIV disease, but is with breast cancer, at Stanford University, where David Spiegel went back a number of years after his group intervention with metastatic breast cancer to prove, because he did not believe that it made a difference for survival. He went back to prove with his data, after he had shown that it helped people with a quality of life, he went back to prove that it did not enhance life, but actually did show that people in his group survived twice as long as people in the control group. And they now have a rather large study replicating that data, so that there are studies going on in major university settings at this time.
We have another caller. Go ahead, you're on the air.
Yes, I'd like to ask, a lot of my friends, heterosexual friends, have been asking, I think they've been minimizing the severity of the AIDS problem. Nationwide, what is the number of AIDS patients, and would you just explain to us what we need to be looking for and what the government isn't really telling us what's going on?
So you're asking for specific numbers of diagnosed AIDS patients?
Yes, nationwide.
Nationwide, I'm not familiar with the latest statistics of
I think that the statistic is 1 million HIV-infected people that are known at this time in the United States. And worldwide, that's many million.
Yes.
Clearly. So it's about 1 million infected still the biggest risk groups are IV drug abusers and male homosexuals with hemophiliacs in this country. In other parts of the world, it's got a large heterosexual component, particularly through Africa, and through parts of Europe, it's highly IV drug abuse. So it changes throughout the world, but it's a very prevalent illness throughout this world.
I believe the Centers for Disease Control said that it's estimated at the rate of progression of HIV disease in India that at the year 2000 there'll be 40 million infected people in the Indian continent alone. And that's heterosexual population.
And as Francesca said, the data so far has been showing by far the predominance has been in the IV drug abuser and the male homosexual population. However, in the last few studies that I've seen, it's beginning to shift a little bit. We are seeing the tip of the iceberg from the heterosexual population now.
In New York City alone, HIV disease and AIDS is the #1 killer of young black women between the ages of 25 and 40.
Yes.
In New York City.
In New York City.
And the fastest growing population of people HIV infected nationwide is young women 14 to 22 in urban centers.
That's right.
We have another caller. Do you have a question for us, please?
Yes, I do. I think most people, or a lot of people, are becoming interested in utilizing non-traditional forms of medicine. Can you address what's happening in the areas of including these types of treatments in insurance plans? Thank you.
Wonderful question.
Thank you for your question.
Well, I'll start it off. They're not doing a lot. I mean, that's the bottom line. In this state, you've got 3 major non-traditional complementary medical schools of thought. You've got naturopathy, you've got chiropractic, and you've got traditional Chinese medicine. Blue Cross Blue Shield rarely covers any of them. Major third parties are few and far between. And the big government subsidized Medicaid and Medicare reimburse none of them. So if you're looking at the HIV population now who have lost all of their insurances, who are on Medicaid cards, the likelihood of them being able to afford out of pocket something that isn't reimbursed through their subsidies is almost non-existent. We're looking at helping to educate the bureaucracies at hand to that acupuncture, chiropractic, naturopathy have value in that they're more cost efficient, and they're less iatrogenic. They have less side effects than a lot of traditional allopathic technologies, and that they should be utilized, along with imagery, groups, etc., before more invasive and costly things are done. But there's not a hell of a lot that is reimbursed.
Interestingly, some of the HMOs are showing increased interest in this area because it's profit-driven. They know that they can reduce the costly care that's costing them money by introducing some of the other concepts, such as we've been talking about, that prevent people from becoming iller.
Yeah, we need to close here. We have one more question. Caller, one more question.
Hello? Hello?
Hello.
Yeah, I was wondering if anybody on your panel really knows how AIDS was started to begin with. I've heard that it's come from Africa and green monkeys and things like that. Myself, I really believe, and you might think this is kind of strange and off the wall, but it isn't if you think about it. I really believe that AIDS could be a biological war virus that kind of got out. And I'll tell you why I think this. First off, man has had the same sexual habits ever since time began, for thousands of years. And it kind of baffles me that this disease just came about in the 1980s.
Do you have a question, sir?
Pardon?
Do you have a question
Yeah,
for the panel?
I want to see your reaction to this, because we have laboratories, and all they do is create viruses. And does any of you think that this theory has any credibility at all? And if not, why? Not.
And thank you for your question, and you're going to have to respond in 30 seconds or less. Who would like to?
I'll take that one on. Your question is well taken. There have been many, many, many theories proposed, and your supposition is no stranger than green monkeys from Africa or from the theory regarding Haiti. No one really knows where it came from. This is not just peculiar to AIDS either. We have a lot of new, quote, viral diseases, unquote, lately. Lyme disease, chronic fatigue syndrome. There is no explanation for why these are occurring now.
And viruses do mutate spontaneously
Yes.
in the environment as well. It does not
Yes.
necessarily mean because they're new that this definitely shows it's been from a laboratory. They do so it's one of those great unknowns.
Yes.
I'd like to thank you all. I'm sorry we don't have more time to answer more of your questions. Thank you for being with us this evening, David, Francesca, and Rick. Remember that the first and second Monday of December, AIDS Forum Live and the Cascade AIDS Project present the Being Alive Medical Update. And in addition, on Monday, December 30th, we shall be presenting naturopathic medicine in the treatment of HIV disease. Thank you for joining us this evening, and thank you in our home audience for the calls.
I'm Rick Tesher. I'm an osteopathic physician, and I've been working with some HIV folks for about, since it began, back in the early 80s. I've shared with you some of my background on the first sheet there, just so you know where I'm coming from. Oh, did you run out? Sorry. Just so you know where I'm coming from, I do come from a background of acute medicine. For 18 years, I was the director of an emergency department, so I'm very adept at orthodox medicine. That's where I was reared and bred and indoctrinated, and where a lot of my belief systems originally came from. What I began to notice a few years ago was that the folks in my practice who really committed to changing totally their lifestyle in all areas, and we'll get into what areas those are a little later, really started doing a lot better necessary to shift those when we choose to shift them. So I had to do some shifting myself because I was very traditional. I don't like the word holism, but I guess I would be referred to as a holistic physician. I refer to myself as a physician in transition, for lack of a better word. One of the other things, I wear several hats. I primarily am board certified in occupational medicine and work a lot as a consultant to corporations in creating wellness programs, establishing policies, procedures, doing pre-placement evaluations, monitoring health and well-being in the workplace. And a lot of what we do now in Omni Medical Group, of which I'm the medical director, has to do with coaching management, supervisory staff, because what we've learned is that the workplaces that we are acquainted with are very, very unhealthy places. And some of the unhealthiest places for the people who work there are hospitals. I don't know if you can relate to that or not. As I have noted there, I do some workshops primarily for my own patients. However, anybody is welcome. There's a wellness workshop, which is an 8-week workshop. A Discovering the Self workshop, which is 6 weeks. Awakening the Heart is an intensive weekend, Friday, Saturday, and part of Sunday. So that's the gamut. And the names are pretty well self-explanatory. It's didactic, it's experiential, it's participative, and we go for the carotid. I guess that's a good way to sum it up. And everybody has a good time. One of the first commitments is we have a lot of fun. I want to mention a disclaimer, and that is that even though I'm an orthodox physician in transition, I don't in any way want to, in my remarks this afternoon, disparage or put down orthodox medicine. There is a place for it. What we've found over the years, and there's burgeoning evidence of this now, is that orthodox medicine is very good at acute conditions. It's not very good at chronic conditions. And that ranges from diabetes to heart disease to HIV. It's all of them. It's not just HIV. I was going to initially define holism for you as I saw it, and I thought rather than that, I'd like to hear what you think holistic means, because you've all heard it. What does it mean to you? Anybody?
It's treating the physical, the emotional, and the spiritual parts of the
Good,
body.
good.
Taking care of yourself at the root.
I'm sorry?
Taking care of yourself at the core.
At the core. And the core meaning?
Like the root of your, like your soul, I guess.
Yes, got it. Very good. Anybody else want to throw something in there? Okay. The range that I hear when I'm talking is anything from woo-woo medicine to something far out to things that are very rational. The truth is that nowadays, and actually not nowadays, for the past 50 years, there's increasing evidence of the credibility, of the scientific validity of doing alternative things in caring for our well-being. Whether we are blessed to have no condition that we're dealing with, or whether we have anything from cardiovascular disease to heart disease, to diabetes, to HIV, or to full-blown AIDS. I, like you, have encountered a lot of confusion out there around holistic ideas and concepts. When I attempt to create something around diet and nutrition, for instance, I read one source and another source, and they all say something different, and it gets really, really confusing. And that's with my background, where I can really understand what they're saying or not saying. So it must be terribly, terribly confusing for you folks. Is that an accurate assumption? Yeah, got it. So what I wanted to share with you this afternoon are a few of the concepts that I live by when I evaluate something. And that brings me to the second sheet. And couldn't define holism better than you folks did. I try to remember names, but I don't. Troy. Rob.
Graham.
Graham, yeah, good. And I've summarized on this second sheet. And first of all, who, in a very quick second, can look down that sheet and spot the typos? Who can do that? How many can find?
I haven't looked. I thought you were asking me as a general rule. Sorry.
Oh, okay, okay.
Sorry.
I have a prize for who can spot the typos on this sheet rapidly in a few seconds.
Got one.
You got one?
What,
Who's
the
got
second
two?
page?
No, a second page.
General principles for assessor?
Yes.
Yeah.
General principles.
Yeah. What are the typos?
Lessons.
Principles.
Principles is one. What's the other one?
Lessons.
Lesson. You got it. Good. I don't know. It's one of the other things I wanted to apologize for. I did spell check after I printed it. So the original on the computer is accurate. The first principle is to look within as well as without, and you folks who define holism really brought that up. I think that it does not serve us that when we're facing anything in life is to look totally out there as either who did it to me or what did it to me or what is out there that's going to cure me or whatever. There's all ways of speaking that. And you know that we all have these voices in our head, you know, the radio stations that are on 24 hours a day except when we're sleeping. We awaken to this milieu of stuff that we have conversations with ourselves about who we are and what we're doing and what we're up to and what we're right, what's wrong, what we should be doing, what we shouldn't be doing, etc. We all wake up into that. And one of the things we do is learn how to manage some of those conversations because it's all stuff we learned. We weren't born with all of those. The second one, trusting your intuitive feelings. That probably means a lot of different things to some of you. What I mean by that is when you hear a conversation in your own head about how you're doing, what's right, what's wrong, what would work for you, it's probably not your intuition. It's that other part of you that has learned stuff over the years by past experiences, by people you've talked to, things you've listened to. It's not your intuition, probably. How many of you have experienced those brief moments in time when you just know that you know that you know? You didn't figure it out? Huh? That familiar for everybody? That's what I mean by intuition. It's that gut feeling. Those are probably accurate for you. And what I would encourage you to do is trust that feeling when it comes up. Because it's probably coming from some deep part of yourself, as Rob said, that is really there to serve you. Okay? It's where you came from before you had all the conversations. A third thing that I apply when I'm evaluating a milieu of stuff, be it diet and nutrition or botanicals or drugs, Western drugs or Chinese drugs or herbal drugs, whatever, is look for that universal thread of truth that you may find when you assess different sources of that information. It's amazing how when you really listen carefully and read carefully, how much you'll find something repeating itself. From something that was written 200 years ago to something that was said yesterday. And when you start spotting that universal thread of truth, for lack of a better name, that's probably got a little more credibility than something else you might hear. And it is true that if something is too good to be true, if it sounds too good to be true, it probably is. Old wisdom, I don't know who said it, but it is probably accurate. The next item there is that I encourage people to be responsible to their condition, whatever it is, rather than for it. A lot of the work of some folks has been misinterpreted by a lot of us by thinking that we are still a question about that when we're through, then that's the time to ask it. Make a little note on that so I won't sleaze out on you. Okay? Good. The next one, I recommend that you use your healthcare provider, whoever he or she is, as a coach versus God. Okay? What this means is not be afraid to ask questions. Ask them when they come up. Make requests. And consider that a partnership with that individual so that your well-being is served. I'll be a little bold here now. If you cannot find that, find a new healthcare provider. Sorry. Because it's not serving you. And I would say that to people with heart disease, diabetes, and HIV. Gamma. The next one is not so much a general principle for assessing options, but rather this is a recommendation, or rather a suggestion, an option for you. That the path to your own health and well-being is really the path to yourself. Now, what I mean by that is what one of the ancient philosophers said was, know thyself, or learn who you really are. It's useful to try to get to that deep part of yourself that just knows that you know why you came here. And I don't mean this afternoon in the HIV daycare center. I mean, but why you chose to incarnate here. And I may be challenging somebody's belief system right there. But whether you believe it or not, we did come here for a purpose. And if we can find that purpose, it's often very useful to understand how that puts into perspective the things that happen to us. Be it relationships that don't work, bodies that are failing us, experiences that don't serve us, things that make us unhappy, etc. The whole gamut. The next item relates to what you brought up on being responsible to your condition, and that is to never stop learning everything you can about that condition, the options that you've chosen or are considering. I love it when one of my patients comes in and they've gone beyond me in an arena and they can start teaching me. I love that. I learn a lot from my patients. There are times when I think I learn more from them than they do from me. And that doesn't, I had to put my ego over here to do that. And that's one of the other things that I would encourage you to encourage from your healthcare provider. And finally, with the typo there, another thing to start to keep on continually learning about is what is the lesson from this condition as a teacher. If we learn to embrace those experiences that we have in life, be they a healthcare challenge, a disease, an illness, an injury, a relationship, as being in our life as a teacher, then this goes back to the old idea of why we came here. I personally don't believe that it happened by accident. I think there's a reason for everything. Sometimes that reason may be rather elusive to us. The next one, and we've sort of touched on this already, there's no cookbook to handling those things that happen in life. Something that's highly successful for one individual may not work for another individual. You really have to create your own plan and become very intuitive about that and trust that and follow that plan. And it may be different for all of you. For instance, there are 10 or 12 of you in this room. There may be 10 or 12 valid plans for you. And you and whoever you're working with as a coach or in your support group can help identify that. There are ways of identifying that. And some of the speakers later on this afternoon will be alluding to some of that, I think. And lastly, It's the only thing on there that says not to do, if you noticed. And if anybody's playing victim role, it's probably not serving you. I would invite you to consider the option of letting that role pass. Leave it to somebody else. Be victim. And I would like to add something that's not on the sheet, and that is, I would encourage you to be discriminating about who you listen to as a source of advice. Don't be afraid to question them, and particularly be discriminating about the voices you hear in your own head. Because I truly believe that our own language, our own self-talk, does create our future. I've been in medicine 25 years, and I've seen it time and time and time again in working with folks, where how they speak about who they are in the world and what's going to happen for them literally does predict. It's predictable. That's what will happen. Chances are. It's called the Pygmalion effect in psychological circles. So, what are the options? And I've separated them into looking outside and looking inside. And as we go through them very briefly, it will become very obvious to you that there's some crossover here. There could have been a middle category of some that are kind of both. Looking outside, the next presenter here today will be talking about acupuncture. I'm not going to spend a lot of time on each of these. However, this might be the time to pause very briefly to answer any questions that you may have about each of these as we go through them. This is not intended to be a comprehensive list. There may be some that aren't on here, and they're not in order of importance. So, with that in mind, I think we'll go by acupuncture and let David answer that in the next segment. If there's any questions on that, unless you have a question of me about that. Okay. Allopathy, orthodox medicine. I would believe that because you're here this afternoon, you have an interest outside of allopathy, or you wouldn't be here. Oh, and thanks for being here, by the way, since we're competing with Dan Quayle this afternoon.
Isn't conventional at 4.
Oh, is he not here yet? Oh, okay.
Yeah, I go then.
Chiropractic. A lot of people in the healthcare professions mix up things here. I don't mean mix them up in the sense that they're in error, but there are chiropractors who do acupuncture. There are allopaths who do acupuncture. There are some osteopaths like myself who do acupuncture. I don't. There are some homeopaths. Rarely would you find a homeopath who would also do acupuncture, although you may. Are there any questions?
Yeah, I'm getting lost now.
Yeah.
I don't understand the difference, or what else you have, I guess, is because I.
Okay, good. That's why
And also homeopathy.
okay, good. Everybody all set with what chiropractic is?
What would be really useful, I think, is to
Yes.
kind of show where they're the same and where they're different. You know?
Okay. Okay. Some of the disciplines that we've mentioned here are hands-on type medicine, like chiropractic, osteopathic. Some naturopaths also use hands-on techniques. Some allopaths have learned hands-on techniques. And then if you go down to the end here, all massage therapists would use hand-on techniques. So there's a vein of similarity through there. And they're all approaching the mind, soul, body from a different point of view. That would be one of the similarities that you'll notice among all of those. received by an MD in terms of the orthodox training. In addition, the osteopath has been trained in the use of using his or her hands to treat the musculoskeletal system, not only for diagnosis but also for treatment. I noted there, especially craniosacral, it's the area, it's a subspecialty in osteopathy of people who have gone to another level and learn to use and interact with the core realm of the human being, with the vital energy that we all have, that who we really are. My personal belief is that the body that spacesuit that we came in with here, that we created, was created by that source of energy, and you can call that whatever you wish and whatever fits with you. Be that, hi. Did you get a?
Get one. Thanks.
Okay. Sorry about that. That source of who you are, and that may be God, that may be the spirit, it may be whatever. It's the source of the energy, and that energy can be tapped into. I'm sure the work you do involves that. Naturopathy is another medical discipline that deals primarily with using the botanicals and other so-called natural elements. I'll leave more of that to Francesca, who's going to talk to you later. I'm sorry, not Francesca, Rita. Homeopathy is a discipline that won't be covered today, but what it is, homeopaths can be, by degree, either an MD, a DO, which is an osteopath, an MD, a naturopath, or a DC. All of them practice homeopathy. I'm sorry, some of each of those may practice homeopathy. Homeopathy is a system of medicine that's a couple of hundred years old, originated in Europe, was used very commonly in the United States around the turn of the century. In fact, some of our major medical schools today were schools of homeopathy around the turn of the century, notably Hahnemann Medical School in Philadelphia. Hahnemann is the founder of osteopathy in Germany. So Hahnemann Medical School was a homeopathic institution. And then the homeopaths got swallowed up by the AMA, and it sort of fell out of favor as technology and other things developed. Basically, it's a system that believes that like cures like, and I'll be very brief about this. It's believed, and there's a lot of evidence for it, that when in a healthy person who has no symptoms that are unwanted, that if you find a botanical or other substance that produces certain characteristics, like let's say you find an herb that produces fever, then it's believed that if you take minute doses of that substance and give it to a person who's experiencing fever, it'll help the body resolve that. Does that make sense to everybody? I gave you a really simplified version. There's a little more to it, but that's basically it. Phytotherapy, that's the botanicals and the herbs. Phototherapy, use of light. Nutrition, and we could spend the whole afternoon on nutrition and diet. I won't get into that. But basically, it's why I would recommend that you seek out a source for yourself that really works. And it has to do with getting rid of all the toxins in your environment and in what you take in. My definition of diet includes not only what you put in your mouth, but what you put in your eyes, your ears, and your skin. All sources. Beyond what you normally hear. You can hear polluted thoughts as well as you can eat polluted food. I'll mention here that in looking for that thread of truth that I told you about before, for myself, in trying to assess as close as we could get to the truth regarding diet and nutrition nowadays. I think probably for myself, the Fit for Life principles that was written into, there's a paperback book called Fit for Life. Some of those principles are very, very useful, and if you look at the background of how the book was only written in the last few years. However, the principles are a couple hundred years old. And the same principles that the Diamonds who wrote the book, Marilyn and, anybody know here? Can't remember Diamond's first name. The guy, Marilyn. Marilyn is the wife. The principles that they propose in their book have threads of truth in a lot of other arenas. So it's why I tend to lean that way. And it intuitively feels right for me. Mind-body work I mentioned there. Hakomi is one example, and probably nobody knows what that is. Anybody know what Hakomi is? Okay. Now, you correct me if my definition is too loose. It's a skill, a discipline, which originally came out of psychotherapy, which found that there is indeed a connection between the mind, body, and spirit, in that patterns that occur in our mind will lay themselves down in the physical body, and that by accessing that through the physical body, you can resolve some other things that are going on. Is that close? Okay. The same phenomenon can occur with a skilled chiropractor and with an osteopath who's skilled in craniosacral. Your access, and with acupuncture. I think we're assessing the same thing. Are you, David?
I am. Okay. Do you do craniosacral work?
Yes, I do.
Great. I got 1 million people to send.
I'm sorry?
I got 1 million people to send.
Oh, no. You know, there aren't many osteopaths who can also do craniosacral. There's only a handful of us in the state. And there are other people who do craniosacral. There are some chiropractors who do craniosacral. There are some naturopaths who do craniosacral work. And finally, massage, last but not least. Looking inside, I'm gonna have to accelerate here a little bit, so I'm gonna go a little faster. I thought I was before. Looking inside, and I just mentioned a smattering of the sources by which one might be guided to look inside, to identifying what we talked about earlier, and learning more about who we really are, why we're here, and what is our personal path to our well-being. And I've mentioned books, tapes, workshops, seminars, meditation, guided imagery, dream work, process-oriented therapy. We have one of the leading process-oriented people in the world in Oregon now, Mandel. What's his first name? Arnie and Amy, his wife, Mandel, from Switzerland. He moved here about a little over a year ago. I have to tell you a story about this. I was in an American Holistic Workshop, and Arnie was doing a presentation, and he and Amy were doing some process work with us, and he happened to mention in the course of the work that he was moving to Portland, Oregon in the spring. I said, wow, we were in Albuquerque or someplace. Psychotherapy, counseling, and support groups and systems. If we have time later on, we can talk a lot more about that. I mentioned the workshops I do. I'm sure Francesca does some work around that. And I'm sure through the work that CAP has, there are a lot of resources that are available to you. Again, I just want to add on books and tapes, be discriminating in the source. Okay? Actually the last page here is a sheet that is from my own workshop on wellness, which is why the title is different up there. But this is the range of what I would recommend that someone consider having in place and creating their own personal path. There may be something missing here that I haven't thought of, but this is the range. In looking through that, are there any questions? Because we're running short on time here.
Energy medicine?
Yeah, okay, good, thanks. Energy medicine is the group name that I would apply to anything that assesses the mind, body, and spirit. That would include craniosacral, it would include acupuncture, acupressure, it would include some massage, it would include homeopathy, naturopathy, combing, anything that accesses that other level of the body besides treating it as a physical organism. Okay? Doing something to it. Yes, Jeff?
Financial security.
Yeah.
Would you expound on that further?
Tell us how to retain it.
What? This could be all afternoon too. A lot of us have a lot of beliefs around around finances, and we could spend a long time on exploring that. But it's my belief that when we believe that we're going to live in scarcity, we will. Look at some of the conversations. Remember these little voices that we were talking about earlier? What are some of the things you learned around finances as you grew up? Penny saved, penny earned. Okay? That's pretty small potatoes, really, when you think about it. Right? What are some of the things you've learned? Throw them out.
We can't afford it.
Can't afford it, right?
Oh,
That's not for us.
And save for the future.
Save for the future, yeah, right.
Don't waste money.
Yeah. Waste not, want not. Okay?
We have to buy it. We have to buy it. You've been watching those U.S. West movies.
What else?
Why pay less?
Why pay less?
Free delivery.
There is
Never buy retail.
nothing's free. There is no free lunch. Sorry. Out of those belief systems, those are beliefs that we have, believe it or not. And out of that, we talk about language creating our future. I believe that a lot of human beings keep themselves in a poverty mode or a scarcity mode simply out of their own belief systems, because it keeps them thinking in a box. I'd love to do a whole workshop with you guys. But what we do around that arena is, what are we believing now? Where do we want to be? And how do we get there? And I heard you say, yeah, how do we get it, right? This is beyond just money. This is not just a money conversation. And for fun, but there's a very, very serious message behind it. I've enclosed Stephen James' 10-step program for how to get sick if you wish to get sick, how to get sicker if you're already sick, and on the next page, how to stay well or get better, and some words from Bob Fulton on what we all learned in kindergarten. A quote that's probably familiar to many of you. The reason I threw this in here was as an example of some of the universal truths. This is not something, Stephen James didn't invent this. This is universal stuff. Now when you read through it, some of it's kind of hilarious, it's kind of funny. But think beyond what's funny. There's a message there.
Is this from a book or something?
Um,
I mean, I've heard of Stephen James, which doesn't mean anything, but
okay.
is it from a book?
I don't know what it came from. It's from one of his writings.
And he is a...
He's a therapist, counselor. Bernie Siegel quotes Steve James a lot. Okay, I'm going to stop there formally and just throw it out for any questions. How much time do we have left? I know I'm over already.
It's 1:52.
1:52. We may want to take another 10 minutes. Be okay? Okay.
Okay, so questions for 10 minutes. We started 15 minutes late, so go for it, folks.
if you're considering working any of these other options, energy medicines,
Yes.
into one's total program,
Yes.
what sources would you recommend first off to look into? Are there centers that offer all of these various energy medicines in one type of place, or do you end up having, is there like a one-stop shopping kind of energy medicine center, or do you have to basically try it? Or is it more hit and miss? Is there directions that guidance that can be sought?
It's all of the above. Let me back up now. There is no Fred Meyer for energy medicine, as I've been terming it. There are some centers. Well, there are some that are close. Yeah. Are you at the center with Francis?
I'm not, but we work together.
Okay. The center is one where there's a lot of different holistic options available under a few close nearby roofs. But a lot of it is hit or miss. You will find the sources in varied places. Like I said, not all people who have the degree in a certain area can do that kind of work. You literally have to search.
Or do it well.
Or do it well.
And do it in a non-judgmental way.
Yes. Yep.
Can I intercede here a little bit? I'm a body worker, by the way, and that's where I come from in terms of this discussion. But I think that there are a lot of people out there with degrees and certifications and centers, and I'm not very familiar with Portland. I just moved here from Colorado 2 months ago. But I think it's very important that you research like you would when you were going to buy a car or you buy a home or any other investment. This is an investment in yourself. And I would suggest, there's lots of magazines. Powell Bookstore seems to have an incredible plethora of information that you can read while you sit there, so you don't have to buy it, to learn about what might speak to you in terms of something you'd like to explore. But I would really encourage you to interview people that you're going to work with.
Yes.
And ask questions. Not just what is your training, because training doesn't always make the person that you need to work with. But what would your goals be in working with me? What would you see me doing for myself? How long would you see this taking? What kinds of things? Would you mind if I talked to some of your clients to know, and really get a feel for somebody? It's like going to get your hair cut. You don't just trust yourself with anybody. And I think it's very, very important, since there are so many modalities to look at. And I feel that especially people in HIV status are very vulnerable. You want something to work. You want to feel the best you can. And unfortunately, I feel people take advantage of that. And I really would encourage you to not be paranoid about it, but at the same time be really open to checking that out. And if you have a question about it and the person doesn't answer that should send up a little flag for you. Or one of these, you need to pay $600 and see me 9 times, and then we'll look, and be willing to try different things in your groups and whatever. Talk to other people about what works for them, because everybody is very different. And from that kind of create an environment for yourself. And it's not anything, none of these are things that you necessarily need to stay with for a year or 2 years. Different points in your life, different things will open up as other opportunities for you.
Thanks.
So talking to friends was one source, books, and everything that Jackie said. Yeah.
Do you accept Medicaid?
Medicaid, yes. Not happily.
I understand.
I have a question. I think I understand what chiropractic is, but I don't understand the subset that you have on cranial sacral work under osteopathy.
Okay.
What is distinctive about cranial sacral work?
It's a big issue. It's a big topic.
What does craniosacral mean?
Craniosacral refers to the cranium and the sacrum, and the mechanism that exists between the two and the whole body, which runs us. That makes sense.
But it's more than vertebral alignment.
Oh yeah, this is beyond vertebral alignment. Yeah, this is
very subtle.
This is not rack 'em and crack 'em. Did I say that?
It was great.
I have a good friend who's also an acupuncturist, Dave, and she and I were really talking deeply about what we felt we were in touch with when we were doing that work. And what we very quickly discovered is that probably acupuncture and craniosacral are accessing similar, if not the same, energy systems. I don't know. When Dave and I are no longer here on the planet, it may be common knowledge that of course you were, you know. My real sense is that acupuncture, craniosacral work, cranial work in the osteopathy in the cranial field, like flower remedies, to homeopathy are all going for the same system in a different route. Now, that doesn't mean that any one of them is perfect. It's just another entry point. And like Jackie said, you have to look for what works for you. I would add one more thing to what we talked about in answer to your question, and that is there's a movie that Paul Newman did here a while back with Big Daddy. What was that movie? Older movie.
Cat on a Hot Tin Roof.
Yeah, Cat on a Hot Tin Roof. Remember how Paul used to drink until he felt the click?
Brick.
Huh?
Brick.
Yeah. Here, read and find out until you feel the click. Yeah. That intuitive part that says, yeah, that sounds right for me. Okay, any other questions?
Well, I think
I didn't answer the thing about craniosacral. It's a tough one. I don't know how to speak it. I don't know how to speak it well,
but
and I do it every day. You're coaching the body's energy system beyond the pulses that you can feel at the wrist and beyond the other things that you can see and touch and feel. There's another primary biological rhythm in the body that is accessible through hands and minds that are trained to receive those impulses. And when you can interact with that impulse and assess from it what it wishes to do, then you can create the space for it to do it in.
Sounds like energy work.
It is energy work.
Okay.
Yeah. I don't know how to speak it any differently than that. But you're working at a deep level of energy.
I assume it's a hands-on.
Yes, it is.
But not necessarily manipulative.
No.
Other questions?
It's coaching, if anything. I'm trying to translate it into terms that are easily understood in Western words.